Well, the Florida Department of Health continues to investigate the source of a multi-county hepatitis A outbreak. The virus is spread by close person-to-person contact as well as through eating contaminated foods. The virus infects the liver and causes flu-like symptoms and jaundice. As of this taping, 119 new cases were reported just last week, bringing the state total to more than 880, exceeding last year's numbers. Here in South Florida, Martin, Palm Beach, Broward, and Miami-Dade have so far reported a combined 26 cases of Hep A. Here to talk prevention and share more about the hepatitis outbreak here in South Florida is Marie Etienne, a registered nurse and hepatitis coordinator for the Florida Department of Health in Miami-Dade County, and Dr. Carla McWilliams, an infectious disease specialist at Cleveland Clinic Weston. Thank you both for joining us. We really appreciate it.
Thank you.
So we were reading the numbers. How concerning are these numbers?
Well, with the outbreak, to talk about the outbreak is at the state level.
Mm-hmm.
So, so we can, in Miami-Dade, we have not seen an increase, in numbers. Right now, Miami-Dade has not been identified by the state as a county where they're having an outbreak. So for Miami-Dade, for the year 2019, we have 14 cases. And half of those cases, are from outside of the United States, so they have a travel history. So our concern are we about numbers? Of course, you are very concerned because, you don't want numbers to go high. But, in Miami-Dade, we can say that we are just monitoring and we don't have an increase. There is no outbreak, identified in Miami-Dade.
So if we see, let's say, high numbers in Pinellas, doesn't mean we will necessarily see those numbers really peak here.
That, is very tricky because, people can travel from Pinellas to come down to Miami. So if the case is identified in Miami, one will have the tendency that is a case that comes from Miami. That's why epidemiology, we have to do the investigation to find out where the case, is coming from. So if there are cases going around counties or countries of Miami-Dade, you have to be you have to do the surveillance and you have to make sure that, other counties or other countries, those cases don't come here to Miami.
Okay.
Yeah.
So doctor, let's start with this. How do we get hepatitis A?
Of course. So it's transmitted primarily through fecal contamination or fecal matters. So for example, if we look at foodborne contamination, it can happen during food handling when food is being prepared.
At a restaurant?
And, correct. At a restaurant, if a food worker didn't wash their hands before they did meal preparation. We can see it sometimes contaminate frozen fruits. There's been linked transmissions to frozen strawberries because the freezing process does not inactivate the virus. Heat and thorough cooking, though, does. But if the food is prepared properly and then brought back to a contaminated area, it can still be cross-contaminated during food preparation. So that's one way. Another way is through close sexual contact with someone who actively has the infection just because of the nature of the intimacy, so to speak. And then other ways is just coming into contact with a surface that may have been contaminated with the virus, for example, in a public restroom if someone didn't wash their hands, simple things like this.
So from both of you, what would be the best things that we can all do? Let's start with, you're eating out at a restaurant. We all eat out a lot here in South Florida. What's your message for us and for the folks working at the restaurant?
Well, the folks working in the restaurant, we always say that, and doctor, if somebody is experiencing, any symptoms of hepatitis, which are like abdominal pain, nausea, vomiting, we don't want it to get to jaundice. They should talk to their supervisor and then they should stay home.
And on the screen, we're looking at some of those symptoms.
Yes.
Fever,
dark urine, they should stay home. And also people should wash their hands before preparing food. We, the people going to eat at restaurant, of course, we have to make sure that we wash our hands before we go to eat. But the best way to prevent hepatitis A is through vaccination. And the vaccine is safe and effective. There are 2 doses of the vaccine given over 6 months apart. That's how you give the vaccine, and the vaccine is very safe. And at the Miami-Dade Health Department, what we've been doing is education, in the high-risk group. We also vaccinate. We used to vaccinate in the high-risk group once a month. But right now, we are increasing our outreach activities. We are vaccinated on a weekly basis throughout, the high-risk group. So to prevent hepatitis, the best way is vaccination and education.
So, doctor, what would be your message? Who needs to get vaccinated?
The high-risk groups need to be vaccinated. I think another important point here is that who,
I'm going to cut you off for 1 second.
Sure.
Who are those high-risk groups?
Of course. So injection drug users, those who may have multiple sex partners are high risk. Those with chronic liver disease, they of course are probably the most at risk for very severe complications of hepatitis A, including death. Organ transplant recipients or other people who are immunocompromised, including chemotherapy, and travelers. We must remember that we all love international travel,
Sure.
and in today's world, if you anticipate that you're traveling to a developing country where there's ongoing transmission, you should be vaccinated a minimum of 2 weeks prior to your planned departure. Then your body has time to make antibodies to those vaccine components and protects you not only when you're there, but also when you return, from not bringing back disease.
And it's about protecting yourself, right? But also your family.
Your family,
Exactly.
your close contact.
Exactly.
Yeah.
What about children? Do parents they'll hear the numbers on the news, and do they need to be especially worried?
Children are now routinely vaccinated. Yeah, so as long as you have vaccinated your children according to recommendations from ACIP and CDC, your children are protected.
As far as hepatitis A goes, long-term impacts on somebody who's contracted it.
Once you get hepatitis A once,
Yeah,
you're not going to have it again. You create antibodies. You will not get hepatitis A again. That's
Correct.
it. You get it once.
Yes,
Yeah,
once, and
once.
that's
And
it.
it doesn't create a long-term disease on you. No.
Can it be fatal?
It can, but it's very
Very
unusual. So the total fatality rates for hepatitis A are around 1%
1%,
or
yeah.
less of people who are infected. So the vast majority of people who develop infections have relatively mild illness. The people who are most at risk for those severe complications are generally those who have immunocompromising conditions and chronic liver disease.
So we get hepatitis A, how long will a person be down for, and how quickly can they recover?
The symptoms can last for 2 months, on and off. So there is really no treatment per se for hepatitis A. So what you need to do is to rest. The physician will ask you to rest and to hydrate yourself, but the symptoms can last for 2 months.
I was reading that one of the challenges in combating hepatitis A is that you can have the virus for a while before you realize what you've got. Is that correct?
It's a long incubation period.
Yes,
Yeah.
it is. And you can start shedding virus before you have full-blown symptoms of hepatitis A. So people who are not having symptoms but in early stages of disease can be transmitting disease and not necessarily recognize it.
Yeah.
That's correct.
What's the hardest part of your job in combating something like this?
The hardest part of my job is to tell somebody, specifically in the high-risk group, that they need to be vaccinated. Yeah, that's the hardest part of
Because
my
they
job.
don't think it will affect them?
They don't think it will affect them. They don't like vaccine, and then that's the hardest part. You may be talking to somebody about, they need to be vaccinated, and then they don't see it. That's the hardest part of our
Do you
job.
think we're getting better in South Florida, though, when it comes to, hepatitis A and educating the population?
Yeah, we're getting better because of public health. We are out there, like we say, we are increasing our outreach activities. We are getting better, in trying to reach out the people. And then, we do this outreach, and then we take the vaccine in front of people. We have other people who are they are leaders who are taking the vaccine. So because of that, we're trying to get better. we're getting better. Yeah.
It might sound simple, but is the bottom line here, we protect ourselves simply by washing our hands a lot?
Yes.
Yes.
Washing
It's
your
the
hands.
best measure of prevention.
Yes, the best.
Wash your
measure.
hands.
Wash your hands, and then wash your hands before you cook food. Wash your hands after the bathroom. You know, wash your hands after you change the diapers.
Excellent advice. Well, ladies, thank you so much. We really appreciate the update. Thank you very much. And for all of the information we discussed today and to learn more about the hepatitis A outbreak in your area, you can go to the Florida Department of Health's website. That's floridahealth.gov. And we'll also have a link on our Facebook page at Your South FL.